In the last decade, the cost of health care for Americans has simply skyrocketed. Let me ask a show of hands here. How many of you in this room, first of all, how many of this room get Medicare? Can I just get a sense? Raise your hands so I get a sense of how many of you are Medicare. Okay. And how many of you in here are veterans and get VA hospital care? Just out of interest. Not that many, okay. How many of you are covered by your employer, and you have employer-based coverage? The vast majority of you. And how many of you have individual plans that you pay for yourself outside of your employer? Okay, not that many. So as you can see, the vast majority of people have an employer-based plan, which is what we want to build on. The reform efforts that are being conducted in Washington want to build on the employer-based system. But the fact is that, let me ask another couple of questions. How many of you have seen your premiums go up in the last 5 years? How many of you have seen your deductibles go up? How many of you have seen your benefits go down? That's the American story. Well more than 50% of you. That is not supportable. So as you sit there and as you listen to this debate in Washington and as we confront the choices, ask yourselves, what happens if we don't do anything? If you just sit there and you have rising deductibles, rising costs of the premium itself, I'll tell you what's going to happen. They tell me that if we do nothing, the cost of an employer-based family health insurance plan will reach $24,000. They're around $12,000 to $15,000, somewhere in that vicinity today. They will reach $24,000 by 2016. An increase of 84%. That means most American households will be spending about 45% of their income on health care if we don't do something. If we do nothing, the average deductible for family coverage increases 73% to almost $2,700 of deductible by 2016. If we do nothing, the number of uninsured Americans goes from the 46 million Americans today to about 66 million by 2016. If we do nothing, employer spending on health care premiums, which most of you have raised your hand and said you get, will rise from about $430 billion a year across America to $885 billion. You can see a doubling of what our businesses have to lay out. They obviously can't afford that. If we do nothing, about 3.5 million Americans are going to lose their jobs due to the rising health care cost premiums. And if we do nothing, 1 in 5 employers will stop offering health benefits in the next 3 to 5 years. So many of you who raised your hands may find yourself working for somebody who begins to pull back from doing that. If we do nothing, those who have private insurance are already going to see a lot of government-strained programs increase, and Mayor Curtoni or Mike Capuano, myself, and others are going to come to you and say, well, we got to ask for more money if we're going to cover this, because it's going to cost more. And obviously that isn't going to work. I know there'll be a rebellion, and people will say, well, I'm not paying anymore because I can't afford to. And you can't. I understand that. Which is why you have to work to reduce the cost of health care increases now. If we do nothing by 2017, and get this one, the fund that currently pays for Medicare is broke, bankrupt, and it will not be able to pay for the benefits at the current level. That is a scant 6 years from now, 7 years from now. If we do nothing, healthcare spending as a nation will rise from $2.2 trillion just last year to $7 trillion by 2025. And if we do nothing, and this is a little scary for those of us thinking about entitlements and how you're going to deal with Medicaid, education, Medicare, and Social Security, and the fundamentals that we have to do, and those are fundamentals. If we do nothing, the gross domestic product, GDP, that is devoted to healthcare will rise from its current 18%. It was about 16% about 5 years ago. 18% today. It will rise from 18% of our total budget, GDP, to 34% by 2040. So that's not supportable. That's why President Obama, that's why many of us are so adamant about pressing the case for doing healthcare reform. And that's before you even get to the moral issue, the coverage issue, and the other issues. It's a practical, fundamental reality about our economy and the choices that we face. We cannot continue to be the only developed country in the world that doesn't cover everybody.